Hi, this is Jeevaratnam and welcome to my channel Jeevan Astro Answers. Actually, there are many kinds of diseases concerning throat, of which tonsillitis, diphtheria, and pharyngitis are most common. And this topic is about tonsillitis. There are collections of lymphoid tissue that form a part of the immune system. Tonsils are the first line of defense against potential diseases and infections. And these tonsils, that is two masses of tissue, sits at the back of the throat. Tonsils act as filters and trapping germs. Tonsils also make antibodies to fight infection, or otherwise the germs could enter the airways and cause infections. But sometimes the tonsils get overwhelmed by bacteria or viruses. This can make them swollen and inflamed. Tonsillitis is an infection of the tonsils. Tonsillitis is common, especially in children, and there are three types, that is, acute tonsillitis, recurrent tonsillitis, and chronic tonsillitis. Acute tonsillitis. These symptoms usually last 3 or 4 days but can last up to 2 weeks also. Recurrent tonsillitis. This is when a patient gets tonsillitis several times in a year. Chronic tonsillitis. This is when a patient has a long-term tonsil infection. Tonsillitis is typically an viral infection, and less commonly, bacteria can also cause the infections. Viral or bacterial tonsillitis can be infectious and spread from person to person. And the most common types of viruses that infect the tonsils include adenovirus, which is a possible cause of the common cold and sore throat; rhinovirus, which is the most common cause of the common cold; influenza or flu; respiratory syncytial virus, which often leads to acute respiratory tract infections. Two subtypes of coronavirus, one of which cause SARS. And the most common type of bacteria that infect the tonsil is Streptococcus pyogenes. However, less often, other species can cause tonsillitis, including Staphylococcus aureus, Mycoplasma pneumonia, Chlamydia pneumonia, Bordetella pertussis, Fusobacterium, Neisseria gonorrhea. Tonsillitis symptoms include the inflamed and swollen tonsils, and it's hard to breathe through the mouth. Other symptoms are throat pain or tenderness, fever, red tonsils, a white or yellow coating on the tonsils, painful blisters or ulcers on the throat, headache, loss of appetite, ear pain, trouble swallowing, swollen glands in the neck or jaw, fever and chills, bad breath, a scratchy or muffled voice, stiff neck. In children, symptoms may also include upset stomach, vomiting, stomach pain, drooling, not wanting to eat or swallow. According to medical astrology, to find this disease, one must look also the position of the planet Mars in addition to the houses and planets ruling throughout. Midhuna Rasi is the Karaka Rasi and it gives rise to the disease. Afflicted Mars in the third house or with afflicted Lord of third house leads to tonsillitis. And the treatment will depend in part on the causes of the illness. On diagnosis, if the test find bacteria, it will be treated by getting antibiotics. But if the test find virus, antibiotics won't help and the body will fight the infection on its own. In the meantime, patient can also try some home remedies, that is getting a lot of rest, drinking warm or very cold fluids to help the throat pain. Eat smooth foods such as flavored gelatins and applesauce. Use a cool mist vaporizer or humidifier in the room. Gargle with warm salt water. And the best way to prevent tonsillitis is through good hygiene, including washing the hands often, not sharing food, drink, utensils or personal items like toothbrushes with anyone. Staying away from someone who has a sore throat or tonsillitis. Although tonsillitis can be uncomfortable and unpleasant, the condition is rarely a major health concern. Most people will recover from tonsillitis within a few days, whether they take medications or not. Most symptoms will resolve within 7 to 10 days. So, don't worry and always be happy and take care. Have a nice day and bye from now.